Hey everybody, this is Sully. Welcome back to the channel. Thank you so much for joining in to talk about the one thing that I think is one of the major problems with American healthcare system, and that is this text right here. This isn't going to be as much of a fun one, so don't expect me to get hit in the nuts, but if you want to see that, just click the link. This is the American healthcare system, and I have one thing to show what's absolutely wrong with our healthcare system, and that is this text that I'm about to pop up, and it simply says bring $1,724.66 on your visit for a scan. And let me preface this. So back in October, I went into the doctor to see about a stomach pain problem I had. I think I ate something bad, and 2 days of having a fever and chills, I couldn't shake it, so I thought, I have insurance, I have very good employer-based insurance, I should go to the doctor. I don't need to sit here and suffer, especially whenever I was taking a week off for a vacation anyway. So 2 days in, I call up, get an appointment, they schedule me for that morning, 11:30, and I said great. I showed up at 11:30 and they said, ooh, our agency, our outsourced agency call center put you down for tomorrow at 12:30. So I showed up a day early because the agency had miskeyed my appointment. And they said they'd fit me in, squeeze me in. All good. All well and good. They did squeeze me in. I got to see a physician's assistant instead of my normal doctor. And yeah. So she tested me for diverticulitis. After going through the symptoms, she thought maybe that was what it was. And I ended up going for a blood test that came back negative. No abnormal white blood cell counts, no nothing like that. So then she said, ooh, we might have to get a CAT scan for you to rule it out. And in doing so, they sent me downstairs to the imaging center to get a CAT scan. And in that CAT scan, they told me at the front desk, we have to clear it with your insurance first because we don't want you to be charged the full amount for the scan. And I said, okay, great. 3 hours pass and they come back and they say, ooh, you're cleared from the insurance. And I'm like, great. Went through the scan, 3 hours, 4 total hours at the doctor's office, and they told me to go home. No help, nothing, just go home. I went home, and they called me with the results saying they couldn't find anything leading to diverticulitis or any other probable cause for my pain. If it gets worse, go to the urgent care or visit the ER system. I'm not joking. And I said, okay. And then they said, oh, we saw something that was a cause for concern. We can't rule out that there's no mass there. So in 3 to 4 months, we want to recheck you, rescan you to see about what it is and if it's serious or if it's a benign condition. I'm like, great, okay. No problem. A month passes, I get a bill from my doctor, $174 after insurance because I hadn't met my $1,750 deductible. I get a bill for $174. I get a bill from the lab for $20. I get a bill from the radiologist who read my scan, $124. I get a bill from my scan center, the imaging center, $1,254, due immediately. That's that's with the insurance clearing. They knocked it down from $1,900. So in November, middle of November, I'm hit with almost $1,500 in bills that I was not expecting for a stomach ache that was not treated. No problem. FSA, HRA, if you're American, you know what these things mean, where we have pre-tax money and it's a way of helping to pay for our healthcare costs. I don't know. There's a long convoluted method. Basically, no matter which insurance tier I would have been paying on, it was $3,000 roughly, or I'm sorry, it was $2,000 roughly that I would have been out of pocket. No matter how I can do that. Of course, the trash comes. So at the end of the year, I shell out about $1,500 for a stomach ache, and I'm told I need to do a follow-up exam. Okay, that's after insurance, and I pay a monthly premium, and I pay into my FSA, and I pay into my HRA. So, just for the record, I would have paid about $100 difference between my company's gold plan, Cadillac plan, and their lowest tier plan. So for the way my health insurance worked, I wouldn't have saved money either way. Now fast forward, I had a stomach ache, got over that, no problem. It was a normal stomach bug that was going around. And then during that time I scheduled a physical, which was 5 months after my scan, my CAT scan, that was inconclusive. So during my physical, my doctor mentioned it and he was like, oh, you really want to get looked at? And he recommended that I do an MRI with contrast instead of a CAT scan due to the radiation, and it's a cleaner scan. It'll show more definitively what's wrong, and it can rule out any type of pancreatic cancer or whatever else it could be, and they could determine. And I was like, okay, that sounds doable. And he said, oh, it's going to cost a good bit more. And he was like, it was probably just a confirmation that I'm just getting older, and you know, at worst case scenarios they find cancer, best case I'm just getting old and it's a normal benign condition. And so I'm like, okay, you know, went through my physical, everything was fine, all my numbers were in line with my age, and they had improved over the past 2 years, so I was pretty happy with that physical. Get out of the physical, and I scheduled with the same imaging center that came up, and you know, they scheduled it, no problem. And they sent me the text that I mentioned at the beginning of this that said, bring $1,724.66 at the time of service, because that's my patient's responsibility. And it was sent in a text, and that cracked me up. It did say text, call for help if I need, you know, help coming up with that. By the way, my scan was set up. I called them on Thursday. They set me up for Wednesday. So I had a week to come up with $1,724 and 24? Yeah, $1,724.66. I'll pop it on screen. It was the greatest text in the world. So I had 5 days to come up with that. And I don't know about the average American worker, but $1,700 is a pretty big chunk of change to come up. And I called, and they said, oh, it's going to be $1,724.66. We'll submit it to insurance and see what they say, if they pay anything extra or not, but they're already knocking it down from $2,600 to $1,700. Don't ask me why. And, you know, but I was still responsible for that amount, would more than likely be the outcome. And I said, okay. And then they said, well, we'll do that. We'll give you what your responsibility will be if they pay as much as they can, which is $500. And I said, all right, I'll bring $500. So 7 days to come up with $500 out of the budget. Not an expected $500. Okay. And I showed up for the scan. $500 paid literally on my credit card right there. Just bam. $500 to get the scan. I don't have the results yet, so that part's a little bit, yeah, I'll let you know as soon as I get them. But realistically, I'm going to end up paying $1,700 plus the $1,250 plus the $250, or I'm sorry, $120, $130, about $3,000, $3,500 after all this, for what's probably going to be a benign condition. My family, fortunately, does not, cancer doesn't run that much in a family, but if it does catch, that's my best outcome, is that I didn't waste $3,000. But I have cancer. My worst outcomes, I waste $3,000 and I don't have cancer. I still have not been treated for anything related to any of these health conditions that possibly could be or could not be. So there's no treatment because they don't know the diagnosis, blah, 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 whatever. Long story short, $3,000 out of pocket. And today, so my health insurance gives me one wellness visit a year, and it's meant for your annual physical. And that's what I did. Because the doctor mentioned my other, it was actually billed as an office visit, which is another $123 out of pocket. Out of pocket. They charged $500 to the insurance company. Insurance company said they're only paying $238, and the negotiated price was $404. So I'm responsible for $123. I don't know how that works out. Why can't there be just one bill and cut out this, they say admin costs are about 35%, and that's why single payer is so much cheaper. And I have to believe it is, because I've spent hours on the phone with billing people trying to figure out, you know, what can I pay, how can I pay, what's the actual charge, and on top of all that, it's not like I can shop around. So, yeah. If you're, I know with YouTube I can see geographic location, and I know quite a few people come here from another country, you know, to come watch videos from other countries, and I don't know how it works in your country, but in our country, you can't. It's very difficult to get a price on a service for a medical service. It's difficult for a price to be compared. It's difficult for a competition to be set because you might only have one place in town that can do it, or there might only be one thing, or your doctor might only have one. It's a monopoly. Insurance is set up so that they can negotiate whatever they have. A doctor can take it or leave it, and I'm left shelling out thousands of dollars for what started off as a simple stomach ache and what will prove to be a simple stomach ache, more than likely. If it's not, I have cancer, and I can look forward to a lot more of the texts that say, hey, bring thousands of dollars with you before you get treated. We don't know what we're going to do yet, but bring, here's your responsibility, pay up front. But yeah, so surprise $1,250 bill, surprise $123 bill, surprise another $120 bill, surprise another $180 bill. These are all not really baked into my budget and very surprising. I don't know how we fix this yet. I would say single payer. I know there's a lot of issues behind that. I feel like if we introduced it quickly, it would be problematic. I feel like over time we're going to have to go that way simply because insurance just isn't cutting it for most people. So anyway, all this video was just to show you the one thing I call the problem with our healthcare system. Is the fact they can text me with a straight face and say, yeah, by the way, by next week, come up with $1,750 and bring it. And yeah, that's what you owe before we'll tell you if you have cancer or not. Great. Yeah. So best case scenario, I have peace of mind and I lose $3,000, $3,500 or so. Worst case, I lost $3,500 or so, and I have cancer, so I have to get ongoing treatments with a max out of pocket every year because one of those treatments will max me out every year. Fortunately, my insurance has max out of pocket. I used to have one that didn't, and that one sucked. And it also had a cap at like $2 million. $2 million sounds like a lot, not when you're in the medical field. So hey, when a doctor can tell you one sentence and have that be billed as an office visit, it was one sentence that was different, and that caused the coding to be an office visit instead of a wellness visit. I'm still trying to fight that one, but I don't know if I'll win or not. And I say fight it, I'm just trying to figure out what it is I owe, how much I owe, and if I can set up anything in advance. So anyway, for all the people who are not in America, this is our system. This is true. This is, I'll put as many pictures as I can of my bills up. If you have any questions, comments down below, please leave them. I love answering questions. I don't mind talking about this stuff. I know not many people do. What's going on? I know not many people talk about this stuff. I know it's a pain in the keister. Yeah, because most people are very private about their finances. But this is my life, my health, my finances, and my country. And we've got a messed up system here. And we have to find a way to fix it. It is fantastic for those of us who can afford it. I don't even know if I can afford it yet. So I say those of us. I don't know if I'm in that group yet. I'm better off than some. I'm worse off than others. That's okay. I feel like our system should at least provide a base level. I don't know. So anyway, leave a comment down below. Appreciate it. Thank you. Give a thumbs up, thumbs down. Let me know what you think. I'll keep you posted on my issues. Sorry I didn't get hit in the nuts today. But, with medical costs being what they are, I'm kind of afraid to rupture one, and that might be expensive too. That would be funny. So thank you once again. We'll catch you later. Hopefully you'll see me soon.